Hello friends, welcome back to another video. In this video I will discuss about saccades and smooth pursuit, very important movements of the eyes, and this is basically important for the supranuclear. So a saccade is nothing but a quick movement, that is a small amplitude eye movement which you use to acquire a particular target. Suppose you want to see an object, and that object you don't that is different from a smooth pursuit where you kind of follow an object. So if suppose an object is slowly moving, you slowly move your eyes, so that is a smooth pursuit. But if you make a sudden movement to fixate on a target, that is known as a quick small amplitude movement, that is known as a saccade. The saccades will usually help to shift the gaze from one target to another. So pursuits will kind of maintain the target, they will maintain the foveation, they will make the image to be focused on that particular part, that is the fovea of the eye. So they are designed to maintain the foveation, that is the pursuit movements. The sixth nerve nucleus is the final common pathway for this horizontal gaze. So in this part I am discussing about the horizontal voluntary gaze. So the most important uh, thing which is responsible for the horizontal gaze is this parapontine reticular formation, which gives its output to the sixth nerve nucleus. So horizontal gaze means we are looking at only the lateral rectus, because the lateral rectus and the medial rectus are important for the horizontal movements in the horizontal planes. So how these two are connected, we all know. This is the medial longitudinal fasciculus which connects the third nerve nucleus with the sixth nerve nucleus. Now this parapontine reticular formation is a horizontal saccade generator. You can consider this as a generator of saccades. So this generator, it consists of two neurons. One is the burst neuron and a pause neuron. So as the name indicates, burst will generate a burst. Okay, they will generate some bursts, but the pause neurons, they are kind of breaks. They will prevent the burst cells from involuntarily firing, otherwise you will always be having some saccades. So these pause neurons, they prevent the burst neurons from firing, and their tonic discharges, they have got tonic discharges, these pause neurons, and they prevent the burst neurons from initiating any extraneous saccades. Okay, now also the smooth pursuit, whatever the input from the smooth pursuit also comes to this PPRF. Whenever you go for a horizontal smooth pursuit movements, this PPRF is the major smooth pursuit movement. Also it regulates the smooth pursuit, but basically you can consider this as a saccade generator, and it has got the pause neurons to keep an eye, to keep stop, to check these saccades, these extraneous saccades from occurring. So basically this parapontine reticular formation is under the control of this frontal eye field. This frontal eye field gets inputs from this striate cortex. Whenever you see an object, suppose you want to see an object, that retina will give the input through the to the striate cortex, and from the striate cortex this frontal eye field will receive the input, and the output, most of the output will be kind of decussating to the opposite side and going to the parapontine reticular formation, and some will go to the superior colliculus and they will again decussate from the superior colliculus, and some will also go to the basal ganglia and then to the superior colliculus. This explains this frontal eye field, some of the output of the frontal eye field goes to the basal ganglia. That's why we can get defect in the horizontal saccades in the case of Parkinson's disease. This explains why you get horizontal saccade defects in patients with Parkinson's disease, because there is output of the frontal eye field. Sometimes some of the output of the frontal eye field, this goes into the basal ganglia and then to the superior colliculus, and then again they decussate to the parapontine reticular formation. So basically the frontal eye field of the right side will supply the parapontine reticular formation of the left side, and the contra and that the contralateral sixth nerve nucleus. And from the sixth nerve nucleus you have the medial longitudinal fasciculus, which connects the sixth nerve nucleus with the third nerve nucleus. So this is the internuclear connection. So that is why any defect of this medial longitudinal fasciculus will give rise to internuclear ophthalmoplegia. We will discuss about internuclear ophthalmoplegia later. Now this third nerve nucleus will also will give the output to the medial rectus. So whenever you want to look to suppose you want to look to the left, the opposite side, that is the right sided frontal eye field will be stimulated. So basically right frontal eye field moves the eye to the left and the left frontal eye field moves the eye to the right. So contralateral there they move the right frontal eye field will move the gaze to the left and the left frontal eye field will move the gaze to the right. So basically because they decussate and they supply the contralateral parapontine reticular formation, which the to the sixth nerve nucleus, to the lateral rectus, and to the medial longitudinal fasciculus, to the third nerve nucleus. Now in the horizontal voluntary saccades there is no much role of the cerebellum. The most important role is played by the frontal eye field and this parapontine reticular formation. Now what is the role of this dorsolateral prefrontal cortex? This dorsolateral prefrontal cortex is kind of a check or an anti-saccade mechanism which inhibits the frontal eye field. So whenever you try to initiate, suppose you have initiated the saccade but you want to control it, it is a voluntary saccade control mechanism. It acts to inhibit the voluntary saccades. This acts to inhibit the voluntary saccades. So it is an anti-saccade mechanism. So if patients have any frontal lobe disease, like any frontal lobe disease or even in Alzheimer's disease or schizophrenia, so when they look away from a visual stimulus, they may be unable to inhibit that saccade. So they have a loss of inhibition of this saccadic, loss of saccadic inhibition they may have. So gauge what happens here. The control mechanisms are different. So just like we had a parapontine reticular formation, the saccade generator in the horizontal saccade, the rostral midbrain, the rostral interstitial nucleus of the medial longitudinal fasciculus. So RIMLF, otherwise known as the rostral interstitial medial longitudinal fasciculus. So this is the medial longitudinal fasciculus which we were talking about, which connects the internuclear, that is the sixth nerve nucleus, with the third nerve nucleus. So this rostral interstitial medial longitudinal fasciculus, the second we had RIMLF, the interstitial nucleus of Castle, helps to maintain the vertical saccade. And this RIMLF, this has got the medial part and the lateral part. The lateral part controls the up gauge and the medial part controls the down gauge, as denoted by the letters U and D. So since the down gauge is controlled by this fourth nerve and the third nerve together, that is the superior oblique and the inferior rectus, the superior oblique is supplied by the fourth nerve, and this the superior will stimulate these cranial nerve nucleus, the third and the fourth, depending on which gauge we want, the upward or the downward gauge, and these are in turn connected with each other by the help of this posterior commissure. And the arrangement of the fibers in the posterior commissure is such that the fibers for the up gauge, that is, as I have shown, you can see that the third nerve is only solely responsible for the up gauge. So the fibers for the up gauge are present more dorsally. As you can see, they are present more dorsally, but for the down gauge they are present more ventrally. So in Perinaut syndrome, what happens, this selective involvement of these dorsal fibers are present. So that's why there is an up gauge palsy in Perinaut syndrome. So this is a posterior commissural lesion. So this is very simple. The vertical gauge is very simple. Now coming to pursuit. The pursuit, how the pursuit occurs. Pursuits are actually generated by this PTOJ, the parieto-temporo-occipital junction, which is the smooth pursuit generator. Okay, now it receives the inputs from the striate cortex. Suppose you have seen a target, and there is a moving target. Now this target, this foveation of this target has to be maintained from the input which the PTOJ receives from the striate cortex. Now from the PTOJ through the internal sagittal striatum, these fibers will pass through the will descend in the internal sagittal striatum, which lies just lateral to the this lateral ventricle. Okay, just adjacent to the lateral ventricle, this fibers from the PTOJ, they will go to this pontine nucleus, dorsolateral pontine nucleus. Now what this dorsolateral pontine nucleus will do, they will project their fibers to the cerebellum. So cerebellum role comes here in the pursuit. Okay, so PTOJ will give fibers to the dorsolateral pontine nucleus. These fibers will again cross to the other side to supply the contralateral cerebellum, and the contralateral cerebellum will then give its output. This is the middle cerebellar peduncle. Okay, middle cerebellar peduncle. As you can see, the middle cerebellar peduncle, this PTOJ to DLPN, that is dorsolateral pontine nucleus, to the left cerebellum, these will pass to the middle cerebellar peduncle, and from the cerebellum the fibers again, the output of the cerebellum will go to the nucleus interpositus hypoglossi and the vestibular nucleus, and again they will cross over to the right side. So that means there is double decussation. As you can see, once from the dorsolateral pontine nucleus to the contralateral cerebellum, then from the nucleus interpositus hypoglossi and the vestibular nucleus to the opposite side PPRF, that is the to the same side PPRF. So the right PTOJ supplies the same side PPRF and the sixth nerve nucleus. So basically by the help of this double decussation, and this will again stimulate the sixth nerve nucleus, and the sixth nerve nucleus will stimulate the lateral rectus, and we can have a horizontal lateral horizontal eye movement that will help to maintain the foveation on the retina. So basically the smooth pursuits are controlled by the PTOJ, and the saccades are controlled by the frontal eye field. These are the two important concepts we need to learn. Then the striate cortex will provide the input to the PTOJ. Then from the dorsolateral pontine neurons there will be double decussation. It will supply to the left cerebellum, the contralateral cerebellum, and the nucleus interpositus hypoglossi and the vestibular nucleus, then to the same side PPRF and the sixth nerve nucleus. So basically the right PTOJ controls pursuits to the right. So that is the same, there is no contralateral innervation. Just like the frontal eye field causes the gaze to move to the left, right frontal eye field causes the gaze to move to the left, but the right PTOJ causes the gaze to move to the right. So it is the smooth pursuit system originates ipsilaterally, right? It maintains foveation ipsilaterally. So thank you very much for your patient hearing. Hope you like this video, and thank you. Keep giving your support. Thanks a lot.